For men in their 40s to 80s, a progression of change in hormones brings about a different set of changes completely in the body, especially in an organ called prostate, which is just below the urinary bladder, deep inside your body. A urologist by digital rectal examination can assess, feel, and look at the configuration of size, changes happening, sometimes make it a suspicious looking feel and take it forward. So men in their 40s to 80s who undergo progressive gradual change in urinary complaints sometimes do see their family doctors and sometimes or rarely see the urologist. The urologist is the custodian of a urinary system. In other words, complaints of urine in men, women, children, elderly, youngsters needs to be taken to a logical conclusion by a urologist in your city, in your town. And it's extremely important for us to understand this. Friends, we are sitting in September 2024. September is rated as or billed as Prostate Health Awareness Month. Prostate health awareness is an important aspect. We miss out many a times informing our colleagues in the society who are men, who are otherwise successful in all walks of life, the changes in prostate will happen. Changes in prostate is almost inevitable for all men. Sometimes you label it as a growth or enlargement of prostate that you pick up in your sonographies or health checkups. Sometimes you complain of obstruction to the flow of urine, where the flow is going slower and slower. The stream is much narrower. You don't empty your urine. And this progressively worsens with passing days, years, and even decades. So as we gracefully age between 40s to 80s, September every year is a very important time. In other words, a full month is dedicated for men to be aware about the changes happening. Men need to be aware that the changes in urinary system many a times are so slow, day by day, millimeter by millimeter, centimeter by centimeter, till a point in time, the growth that you measure on the prostatic enlargement brings about the occlusion to the urinary passage to such levels that you start complaining. So why not wake up as all men who see this today, that if you have a urinary complaint where the urinary flow is lesser than normal, you can't paint on the wall anymore with the speed that you had in the past. You take time to empty, you pass intermittently and empty in one or two goes, and thereafter you have to go again and again because you partly emptied and partly did not empty your urinary bladder. Much of it is also seen on an indirect test called sonography, which is not the main test. The main test for all prostate issues or all obstruction issues will be a uroflowmetry, measuring the flow of urine when you pass urine in a full bladder in a computerized toilet, which is in the privacy of a toilet that we have at the Kokilaben Hospital in the Department of Urology. So, for a urinary complaint, you would see a urologist. And for urinary complaints which are continued around, let's not wait for a trouble to happen before we wake up. On one side, the prostate is progressively enlarging. Its enlargement externally visible on a sonography could also be enlarging internally, and that narrow urinary passage, which in men is 18 to 20 centimeters, whose beginning is governed by the prostate, can be blocked, occluded, and also completely blocked. Possibility of you passing drop, possibility of you requiring a urinary catheter overnight in an emergency is not uncommon if the progression is happening and you are postponing it. So don't postpone prostate health. It is important that we create positives in prostate health for the whole month of September for all men in the whole world. Sitting at the Kokilaben Ambani Hospital, where I, Dr. Sanjay Pandey, as a consultant urologist, would look at this long hours of work where we look at patients being counseled, patients being explained, they being examined, logically being taken through that evaluation, investigation, scoring, and treated. Attempt to cure those individuals who are on the precipice where the obstruction is getting bigger and bigger. The September every year is celebrated towards awareness and awakening of all men. So men who go through this trouble of urinary flow not good, taking medicines and not improving, medicines which are not helping you out, but still taking every month, every year, because the family doctor gave it as a part of the large protocol, needs to be re-evaluated, needs to be relooked. And ultrasound is not the only test. I wake up many a times telling people that a urine routine and culture, giving a proper urine specimen, which is a midstream and a clean cat specimen, where the urine specimen is not contaminated by your prepuce, which is normally having bacteria and fungus setting in, unless you pull the skin back, wash it up very well, and not give the first part of urine, but the middle part of urine in the bottle without touching the bottle, the specimen is wrong. The specimen always has to be a midstream clean cat specimen. Let's not treat the urine report, which has been a contaminated specimen given through the prepuce, through contamination, or not rightly given. Very important. So, friends, awakening is important because we all are progressing gracefully. Changes will happen and are happening. I think At a time when we are looking at feeling otherwise very comfortable, let our health not be punctuated by changes where a prostatic enlargement blocks the urinary passage, for which treatment today has become minimally invasive. When you pick up in time on a moderate to a small prostate compared to the larger prostates, people who have a development of another direction completely, which is called as a cancer prostate. Cancer prostate is an adenocarcinoma. It's more of a hormone related cancer. It can be completely manipulated by hormones if it is spread, but therefore the awareness today on doing a PSA as an annual test. The total PSA, an annual test which is less than zero point 0.4, is an important test. Let's not do PSA when we have severe burning, discomfort, retention of urine, where the PSA can shoot up and would give you a wrong modus operandi that you have a cancer, which is not true. So I think awareness is missing and awareness needs to be taken to people around. But any and everybody who has got urinary complaints in this city where my colleague urologists take care of you, at the same time in cities where you are in, must see your urologist. At the Kokilaben Hospital, from Monday morning till Saturday evening, as we see routine cases and we spread the awareness from the platform like this, we look forward to men understanding that the prostate changes can be completely managed, can be treated medically if we pick up in time, can be treated by medically uh, combination therapies as required for people who have got urgency, frequency, urge incontinence, can be treated to cure by minimally invasive therapy today, like the Urolift, which I'm involved in, where we open up the prostatic passage in such a way that the occlusion goes away, which was happening progressively. And you did not have a major surgery, major cut, but obviously you had a major therapy where you got from treatment to cure, and you did not continue to damage the bladder, which is the project that I follow called Save the Bladder. Friends, cancer prostate is a treatable and a curable disease. Cancer prostate, unfortunately, can happen to individuals at walks of life, and men in their late 40s to 70s and 80s could have picked up their cancer prostate earlier than later. And earlier than later is only by a urological evaluation. And therefore, be friends to a urologist. See your urologist in your locations. If anybody is in this part of the country or the city, you're welcome here to be seeing us and taking it forward. I examine everybody. I look forward to your evaluation, look forward to your scoring, look forward to how you're doing on a flowmetry, which is almost an ECG of the urinary bladder, giving me the kind of change happening through the urinary passage, which is getting gradually occluded by the prostate. So friends, prostate health is an important aspect of life. I know we speak loud and clear on this very regularly, but because it does not hit us till it becomes an emergency or till it becomes bothersome, we probably don't go to and see our doctor. And therefore, please bring prostate health positively to the front row seat. Look at your urologists in your cities, and you're welcome to come and see me here and my colleagues here and take it forward to the highest possible level towards treatment, towards understanding, towards therapy and cure, which is what we aim all through 365 days and more so focused in this Prostate Health Awareness Month. Friends, wishing you goodbye and making each of you an ambassador of prostate health from the Kokilaben Ambani Hospital. We meet again and again, and we look forward to this channel, which gives you those kind of support and idea and information that you need to take forward to identify what could be going wrong as life changes. Have a great day.